High blood pressure, also called hypertension, is often called the silent killer. It has a way of creeping in without much warning. You might feel fine, have no obvious symptoms, and yet quietly it could be putting your entire body under strain. It is one of the most common health concerns, especially as we get older. Yet it is something that many people only start paying attention to after a scare. So maybe you notice a sudden spike during a routine checkup, or you hear about a friend's stroke or other heart issue. Hi, I'm Valerie, a wellness nurse. I believe that no matter your age or current health status, that you have the power to take charge of your well-being and live a longer, healthier life. My goal is to share with you the knowledge and tools that will empower you to make that happen. In this video, I want to help you understand what high blood pressure really is, why it becomes more common with age, how lifestyle plays a powerful role in both causing it and controlling it, and what you can do to better manage it and to feel empowered as your own healthcare advocate. So let's start with the basics. Blood pressure is simply the force of your blood pushing against the walls of your arteries as your heart pumps it around your body. It is measured with two numbers. The first, called systolic, is the pressure when your heart beats. The second, diastolic, is the pressure when your heart rests between beats. You've probably heard that a normal reading is around 120/80. In this example, systolic is the 120 and the 80 is the diastolic. When those numbers start to rise consistently, so either one or the other or sometimes both, it means that your heart and blood vessels are working under extra strain. Over time, this constant pressure wears down your arteries. They can become stiff, narrow, or damaged, making it harder for blood to flow freely. Your heart has to work harder, and that extra effort increases your risk for serious conditions like heart attacks, strokes, and kidney problems. The tricky part is that most people with high blood pressure feel completely normal, which is why it often goes unnoticed until something more serious happens. Now, you might be wondering why blood pressure becomes more of an issue as we get older. It does happen, but it is not something that we have to accept as inevitable. As we age, our blood vessels naturally lose some of their elasticity. They become less flexible, more rigid, which makes it harder for blood to move through them easily. There are also some hormonal changes and shifts in how our kidneys handle sodium and water, both of which can influence blood pressure. While these age-related changes create the conditions for high blood pressure, they don't guarantee it. Your lifestyle, your habits, and the choices you make every day can either accelerate or slow down this process. A combination of factors raise the risk of developing high blood pressure. For some, it does run in the family. If your parents or close relatives have dealt with it, you might be more likely to face it too. But genetics is just one part of the story. As I mentioned, age plays a role, especially after 65. And for some communities, high blood pressure is more common. But the most influential factors are actually the ones within our control. What we eat, how active we are, how much stress we carry, whether we smoke or drink, all of these can contribute. Carrying extra weight adds strain to your heart and blood vessels. Not moving enough can cause your body to lose the natural tone in your arteries. Even conditions like diabetes or sleep apnea can set the stage for hypertension. So while some risk factors are out of our hands, many are not, and that is where lifestyle comes in. Not just as a cause, but as a powerful tool to bring our blood pressure down closer to normal. The reason that doctors pay so much attention to high blood pressure is because of what can happen if it goes unchecked. Over time, this extra pressure takes a toll on the entire body. The heart has to pump harder than it should, which can lead to thickening of the heart muscle. That might sound like strength, but in reality, it makes the heart less efficient, increasing the risk for heart failure, heart attacks, and irregular rhythms. The brain is another area of concern. High blood pressure can lead to strokes by causing blood vessels to rupture or become blocked. And even without a stroke, it is linked to cognitive decline and dementia. Your kidneys, which are responsible for filtering waste from your blood, can also be damaged, leading to kidney failure. And even your eyes can suffer. Elevated pressure can damage the delicate vessels in the retina, potentially leading to vision problems. All of this can happen silently, which is why regular checkups and self-monitoring are so important. But just as important as knowing the risks is knowing what you can do about it. Now let's get to the heart of it. How lifestyle can help lower blood pressure naturally. There is no one magic solution, but small, consistent changes can add up in powerful ways. Let's start with what we eat. A diet rich in fresh vegetables, fruits, whole grains, and lean proteins supports healthy blood pressure. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, has been shown to be especially effective. This way of eating emphasizes potassium-rich foods like bananas, sweet potatoes, and leafy greens, which helps to balance out the effects of sodium in the body. Reducing processed foods and salty snacks is also an important part of it. Most of the sodium that we eat comes from packaged and restaurant foods, not from the tabletop salt shaker. Physical activity is another cornerstone. Moving your body helps strengthen your heart and improve circulation. Aim for at least 30 minutes of moderate activity, like brisk walking, most days of the week. You do not have to run marathons or hit the gym for hours. Consistency is more important than intensity, so find something that you enjoy doing so you stick to it. Alcohol and smoking also play a role. Cutting back on alcohol or avoiding it altogether can lower your blood pressure. Smoking damages blood vessels and raises your risk of heart problems. Quitting, if you still smoke, is one of the best things that you can do for your blood pressure and your overall health. And then there is stress. Chronic stress can keep your body in a state of high alert, raising your heart rate and constricting your blood vessels. Finding ways to unwind, like through deep breathing, meditation, yoga, or simply taking the time to rest and enjoy life, can help bring your pressure down. Weight also matters. Even losing a small amount of weight can make a noticeable difference in your blood pressure. It is not about perfection, but about progress. Every pound lost can help lighten the load on your heart. Sometimes lifestyle changes alone are not enough, and that is where medications come in. There are several different types, and each works a bit differently. Some help your body get rid of extra fluid and sodium, which lowers the volume of blood in your system. Others relax your blood vessels so blood can flow more easily. Some help your heart beat more slowly or with less force. It is not uncommon to need more than one type of medication to get things under control. And I always encourage people to have open conversations with their healthcare providers about how they are feeling on any medication, because adjustments can be made. Medications are tools, and they are important ones. And if they are prescribed, you should take them. But they work best when paired with daily habits that support your heart and blood vessels. One of the most important things that I want to emphasize is the role that you can play in your own health journey. Managing high blood pressure is not just about what your doctor tells you to do. It is about knowing your body, understanding your numbers, and making choices every day that move you towards better health. So if you have high blood pressure, check your blood pressure regularly at home. Keep track of it. Notice patterns. Bring that information to your appointments and ask questions. If something does not feel right with your medications or your plan, speak up. The more you understand what is going on in your body, the more power you have to influence the outcome. High blood pressure is common, but it is not something that you have to accept as inevitable. By understanding how it works, how it happens, and what you can do about it, you can take back control. So whether you are working to prevent it or if you are already managing it, Know that every small step that you take matters. You do have the power to influence your health through the choices you make, what you eat, how you move, how you rest, and how you care for yourself daily. And when medication has become part of the plan, it does not mean that you have failed. It just means that you are using every tool available so that you can keep feeling your best. So if you are on this journey, know that you are not alone. Keep learning, keep asking, and keep moving forward. Your heart will thank you. If you are ready to start building healthier habits that support your blood pressure, your heart, and your overall well-being, take a look at my Thrive in 25 program. It is designed to help you make simple, sustainable changes one at a time. Each week, you will focus on just one small shift, whether it's improving your nutrition, managing stress, moving more, or getting better sleep. These are the same kind of habits that support healthy blood pressure naturally without being overwhelmed. You can find a link with more details in the video description. And if you like this video, please give it a thumbs up and subscribe for more practical science-backed wellness tips. I would love to hear your thoughts in the comments. What's helped you manage your blood pressure, or what questions do you have? Let me know. I love hearing from you and try to answer as many questions as I can. Thank you so much for watching, and as always, please take good care of yourself.